You're listening to the Resilient Fertility Podcast, a space where we explore the intersection of food and culture on the journey to motherhood. I'm Anissa Woodall, a holistic certified nutritionist and mother of 2 adventurous boys. Join me as I guide you on how to reconnect with your innate wisdom, develop a growth mindset, and harness the power of food and habit to embody the mother your child needs you to be. Whether you're planning to become a mother, trying to conceive, or are already a mother, you'll find valuable insights and practical tips to enhance your fertility and optimize your pregnancy. Tune in every other week for thoughtful and informative conversations about the power in your hands on your journey to motherhood. Welcome to the Resilient Fertility Podcast. I'm always talking about how your body is always communicating with you through your symptoms and your signs, and how it's our responsibility as sovereign women to take that radical responsibility to listen and to know when and who to ask and seek out specialized care from if it is necessary. I know many of you are like me in that you like to take the reins of your health and you see yourself as your own health advocate, taking what the quote experts say and seeing how it resonates with what your own experience has been like, and not just taking things at face value without truly questioning it. With that in mind, I invited Dr. Katie Lee, a holistically minded dentist and author of the book Saved by the Mouth, who shares how her own fertility was impacted by her oral health and all about the connection between oral health and fertility. We'll learn how simply brushing and flossing is not always enough to prevent oral disease or bacterial imbalances, the 3 types of pathogenic bacteria that can directly impact fertility and or influence pregnancy health and can even play a role in pregnancy loss. When is the best time to get dental work done if you are planning to conceive, already trying to conceive, or are already pregnant? What kind of testing you can do to learn more about your own oral microbiome, and so much more. In this episode, you'll also hear me share my own oral health journey and some of the strategies that I'm using and recommend to achieve a healthy oral microbiome and overall oral health. And of course, you'll learn how you can experience resilient fertility by getting to the root of your oral health, pun intended. I'll read her bio and then we'll jump right in. So Dr. Katie Lee is a dentist, speaker, author, and coach who lives in Aurora, Colorado. Dr. Lee graduated from University of Illinois at Chicago in 2010 and was an owner partner in over 80 dental supported organizations, supported dental practices throughout the U.S., and served as a clinical partner overseeing 5 states. Currently, she consults for health technology companies and provides implant education for general dentists. Dr. Lee has 2 passions in her profession: dentistry itself and making other dentists successful. Her passion about the oral systemic health link comes from her own personal experience. Dr. Lee was involved in an ATV accident as a teenager, which left her without many teeth and rendered her jaw immobile. Dr. Lee experienced how oral health affects systemic health and the benefits of dental implants. Her first-hand journey in recovering from the effects of dental trauma led her to specialize her career on the mouth-body connection and dental implants. Dr. Lee searches for proven technologies that improve clinical outcomes and the patient experience and loves to educate her peers on those technologies. Dr. Lee authored a book titled Saved by the Mouth to educate her patients and clinicians on the importance of overall oral health. Dr. Lee has won many accolades, including Top 40 Under 40 Dentists in America and International Women of the Year in Dentistry. She has been featured on local Fox and NBC news stations discussing the importance of oral health. You can find her at katieleedds.com, and on Instagram, she's at katieleedds. Same on Facebook, same on LinkedIn, and same on TikTok. You can read more about her book at savedbythemouth.com. Welcome, Dr. Katie Lee, to the Resilient Fertility Podcast. It's so great to have you here.
Thanks for having me. I'm excited.
Of course. So if someone is experiencing heart problems, they often will see a cardiologist. If someone is experiencing GI problems, they are told to go see a gastroenterologist. If someone is experiencing hormonal problems, they often will see a OBGYN because that's who they're referred to go see. This approach, in my experience, although providing people with specialized care when needed, leaves us thinking about the body in compartments rather than as an integrated ecosystem. So, you're here with us today to reveal some of the blind spots that we may be having when it comes to our fertility and how we might be compartmentalizing our oral health apart from our reproductive health. So, I'd love if you could just start by sharing with us what is the connection between oral health and fertility?
Yeah, I loved how you started the conversation about healthcare being so siloed. Because oral health has been completely removed from medicine 100 years ago. And because of that, there's been unintended consequences. And one of those being patients, lay people, dentists, and doctors don't necessarily understand how the mouth is connected to the rest of the body. And what we know through research is that oral health has a tremendous effect on a lot of different systemic diseases, those being fertility. And what we know is it affects fertility in two ways. One is that we have oral microbiome is the first one that we get when we're born. And because we're essentially born sterile. And so everything that is in our mouth, we have acquired from those around us. And our oral microbiome feeds our gut microbiome. And so it has all of these important factors when it comes to our immune system and our inflammatory system. So our oral microbiome directly affects fertility. And then the other way that oral health affects fertility is going to be through inflammation. So what's in our mouth can cause not only localized inflammation, but systemic inflammation. And that can have major effects on fertility, on pregnancy, delivery, and maternal health outcomes. That's for you.
Yeah. And in your book, you mentioned that there's 700 strains of bacteria that are found in the mouth. That's pretty amazing. And you also mentioned how there's 11 specific strains that are often causal of periodontal disease and systemic diseases. So which strains are potentially problematic for some people, and why might they impact some people more than others?
Sure. So the oral microbiome, as you mentioned, is super complex. So there's over 100 different strains. We know that there's 700 to 1,000 strains in the gut, so it's very similar. We know is that the oral microbiome is very unique, and it's robust in terms of not only do we have bad pathogens in our mouth, but we also have a lot of good pathogens. And as long as it's balanced, it's just like your gut. As long as it's balanced, your good bacteria will bad pathogens at bay. But what happens is we get 11 pathogens that I mentioned in the book. And we have oral dysbiosis, decrease in acidity, nitric oxide, all these other things. The bad pathogens will start to overpopulate, and they can wreak havoc not only in our mouth and cause gingival disease and periodontal disease, can get into our bloodstream and circulate chemically and cause remote damage as well. And so the ones that are specific, especially to fertility, are going to be Fusobacterium nucleatum. And then another one, Porphyromonas gingivalis, or PG. And then the last one that I routinely talk about is Tannerella forsythia, or TF. So FN, PG, and TF are the main ones that are going to cause gum issues as well as fertility issues.
Okay. And I'll make sure to spell those out in the show notes if people want to go back and look at really understanding exactly which strains they are. And so considering that, what are some of the impacts that these bacteria can have, overgrowths of these bacteria can have on overall fertility?
I always say that FN is like the Uber bacteria of the body, meaning that FN has little surface proteins on the outside of that bacterium. And those proteins allow it to bind to our tissues and freely pass through membranes, through tissues, and it can really easily get into our bloodstream and circulate everywhere. It can basically get anywhere in the body that it wants to. But what the problem with FN is that it also takes other bacteria along with it. It's getting ready to go through our gums and get into our bloodstream. It could say, hey, PG, hop on with me and I'll take you down female reproductive system. So that's really why FN is really bad. An article that just came out in March talking about FN is implicated in 50% of colon cancers. It's really scary. But back to fertility. And when it gets to the female reproductive tract, it's the metabolites of the FN bacteria are toxic to the fetus and can actually cause death of the fetus in stillbirth. So when someone does have a stillbirth, oftentimes it's because of an FN infection. Then increases the risk of infertility by 3 times. FN has all kinds of issues with health of pregnancy overall. And then we have PG, and PG does all kinds of horrific things. Males, what PG is going to do is it decreases nitric oxide production. Nitric oxide is a very potent vasodilator. And so men need vasodilation in order to achieve erection. So a lot of males will suffer from ED. And I always want to test them to see if they have the PG bacteria present, because that could be part of it. PG also is going to affect the sperm count, their ability to swim, and the shape of the sperm for man or for men. And then in women, PG makes it very difficult to ovulate, makes it very difficult for that embryo to implant into the uterine wall. And then if we are able to achieve a pregnancy, it makes it very difficult to sustain the pregnancy because it will cause a lot of vascular inflammation. So it'll get inside the umbilical cord, the spinal artery, cause a ton of inflammation, which can lead to reduction of growth factors. So the baby won't be able to form properly, lead to miscarriage, of course, or preterm birth. And can also, vascular inflammation will reduce oxygen being flown to the baby as well. We can undergo hypoxia, which is obviously not good. And TF, the way that TF is implicated is TF is present first in gingivitis, more so than gum disease. And the distinction between gum disease and gingivitis is that gingivitis happens first. That's when people experience bleeding gums, which is really common in pregnancy. And then if that's not treated, the infection goes from the gums to the bone, and the bone around the teeth starts to decay, turn necrotic. And so TF is really implicated first, gingivitis, and PG needs TF to be present before it can on the scene. So we want to catch patients when they have TF and hopefully eradicate it so that PG will never form.
Mm-hmm. And so how are people exposed to these bacteria? Do they get it through their food? Is it just through our general environment? How do these bacteria overgrow, right? Because I think both for myself as well as my audience, we're always very like root cause oriented. And it's if we absolutely have to, then we'll use like antimicrobial approaches. But it's like, how do we prevent that overgrowth from happening in the first place?
Yeah. So a couple of things. When we're born, essentially sterile. And so I mentioned earlier that our first introduction to microbiome is through the mom's vaginal canal. And mouths are essentially sterile. So everything in our mouth we have acquired from something or someone somewhere. So we are very much influenced by our environment. Especially if someone's trying to conceive, that means your partner. It means coworkers, anyone that's around you in your environment, you can transfer that bacteria back and forth. Of course, it can be on your food as well. So we have to be careful who we're surrounding ourselves with, to be careful what we're eating, but then we also need to make sure that we have a very robust and healthy immune system, because the better our immune system is, and a lot of our immunity comes from our gut microbiome, the better able our own oral microbiome will be at maintaining its own health and not allowing the bad pathogens to go over. And so what I always say is, it's for most patients, unfortunately, the shift in the balance between good and bad bacteria has already occurred, or it's been going on for quite some time. And so oftentimes patients do have to get tested. If the bacteria are present, we do have to render treatment. And then once we balance it for the patient, they then can go and maintain it. So that way they don't have to get ongoing treatment on the road. But very hard to rebalance the microbiome on like by someone's own accord, especially if there's fur on the teeth or something like that, because they can't remove that by themselves.
Mm-hmm. And when it comes to, I had a question on my mind. What was I about to say? Let me take a minute for a second. So when it comes to gut health, oftentimes we have very obvious signs and symptoms, right? We might have gas or bloating. We might have constipation or diarrhea, abdominal cramping, reflux, the list goes on. Is there a connection between digestive symptoms and oral microbiome health? And tacking on another question to that, do you have to have obvious symptoms of like oral imbalance to have these kind of overgrowths present?
Yeah, let me your first question first. Cannot have a healthy gut if you do not have a healthy mouth. That is like full stop, 100%. I think we're much more aware of the symptoms in our gut because they're uncomfortable. So when you have that bloating, that gas, GERD, uncomfortable, it's embarrassing, want to go out in public. And so those are very obvious signs. But we need to remember Beginning of the digestive tract, the beginning of our digestive process starts in the mouth. And so again, because dentistry has been siloed, been taken out of the digestive system and kind of put into our own entity, digestion starts in the mouth. We secrete enzymes in our mouth, we chew our food, and swallowing over 80 trillion bacteria a day. Now, most of the bacteria in the mouth can't survive the stomach acid. So even though we're swallowing the bacteria, most of it's going to get killed off when it gets to our stomach and small intestine. Now, the other thing that happens is the oral microbiome will cause a localized inflammatory response. The body will create a collagenase enzyme that will start to break down our gum tissue. Once the gum tissue is broken down, it essentially has little holes or perforations in it. And the bacteria that are living underneath our gum line then go through the gum tissue into our bloodstream and then get to the gut. So that's how oral bacteria are found in the gut. That's how FN, the colon, for colon cancer. And the body knows that those bacteria don't belong there. So it will cause a lot of issues. And one of the very first things that people started noticing is that when people would come into the dentist office and they would have recurrent canker sores called aphthous ulcers, those were actually the first sign of IBS or Crohn's disease. And huge in a lot of patients identified and diagnosed as having IBS and Crohn's disease because it's all the same system. It's all part of the same tract. It is very heavily connected. You cannot have a healthy gut without having a healthy oral microbiome. Now to your second question of, let me remember if this was right, was someone have an issue in their mouth and not know it? Was that kind of your question?
Yeah, essentially they don't have bleeding gums, they don't have any cavities, or just like no kind of obvious inflammation. Can they have an overgrowth of pathogenic bacteria? And is that overgrowth problematic even if they're not symptomatic? Or will they always be symptomatic if they have overgrowths?
That is such an intelligent question. I don't think anyone's ever asked me that, but that really gets to, I hope I can remember to say everything that I want to say right now. Things. One is you hit the nail on the head of they have this overgrowth, and would that always cause an issue? And the answer is no, it won't always cause a systemic issue. And that is totally dependent on the patient's immune system. So we have some patients that have horrible microbiome profiles, like all their test results, and they're off the charts in terms of having all of this bacteria in their mouth. Sure, they're going to have oral symptoms, but because their immune system is robust and healthy, that bacteria their gum tissue is not breaking down and not being perforated, and it's not getting into their system, and it's not going to damage their heart, but other places like that. Vice versa, I've had patients come in that have very little pathogens present, but they have an overactive immune system, such as rheumatoid arthritis or DDS patients or something like that, eczema patients, psoriasis. And so very little bacteria that are present will cause a lot of systemic damage. Now, back to your question, and someone have an overgrowth of bacteria and not really know it. People will have oral symptoms. It's just whether or not they're paying attention to those symptoms. In gums, a lot of people will say gums never bleed at home. They only bleed when I come to the dentist and you poke them. Well, that's because number one, not brushing properly, so they're not getting down to the gum line. It's also never flossing, or if they floss, they don't actually get the floss beneath their gum line. Or maybe they're just not paying attention at all if there's pink in the sink. One is ptosis or mouth odor. Some people are completely naive, or not naive, but blind to the fact that they have bad breath, but they don't know it. And that could be a symptom of sleep apnea. It could be a symptom of acid reflux, or it could be a symptom of a bacterial overgrowth. Yes, they'll have signs and symptoms. It's just whether or not they're paying attention to them.
Yeah. One foundational thing that I focus on with my clients is optimizing gut health. And I'm curious if your approach to optimizing oral health is similar to like the way I'm talking about it. I am compartmentalizing it, right? I'm going against what I'm saying, but looking at the gut as a whole singular tube, I would expect the same changes that would support a healthy intestinal microbiome would also support a healthy oral microbiome. In your experience, how does your approach potentially differ, or is it pretty similar to some of the foundational supporting optimal gut health kind of strategies?
Yeah, there's definitely some similarities, and there's definitely some differences too. Similarities are going to be to make sure that we're supporting the microbiome that's there, the good pathogens. So we want to make sure that we're getting good probiotics and prebiotics. We want to make sure we're supplementing Teeth and gums need certain vitamins and minerals to keep them strong and robust. So that's very similar. However, the strains that are important for oral health, similar, but there are some differences to that health. Again, isolated microbiome. Bacterial strains are a bit different. The one thing that is really different in oral health, though, is its exposure to the outside world, right? And so it's much more affected by our environment. And it's also what I call etiology in the mouth. So versus the gut, we actually will get hard calcium deposits that stick to our teeth, right? Plaque that we get on our teeth that starts to form as little as 20 minutes after eating or drinking something. We start to get this biofilm that forms on our teeth. Then it mixes with the minerals in our saliva and it hardens. Once it hardens, it's like this, and plaque is too. It's a very tightly woven, very strong substance that promotes other bacteria to grow on top of it. And so you could take all the probiotics and prebiotics and vitamins, minerals in the world. If that is on your teeth whatsoever, plaque or tartar, you can't have a healthy oral microbiome because you have etiology. So we have to go one step further, and that's where the treatment is needed. Because we can't just rebalance the oral microbiome if there's etiology there. We have to remove the source first and then try and punish it the best we can, and then educate the patient on how to maintain it so they don't get the buildup of etiology again. It's also affected by mouth breathing. So if people go to sleep at night and they suffer from sleep apnea, or maybe they just breathe with their mouth open or snore, it affects gut health, but about it, you're breathing it in through your mouth first. So that's going to totally disrupt a microbiome that we've worked so hard to balance. Also affected by cavities. The bacteria that cause cavities are completely different than the bacteria responsible for gum inflammation. So we're dealing with many different factors here, and it's very heavily influenced by outside world because the mouth is so close to our environment.
Mm-hmm. Yeah, I'm glad that you touched on mouth breathing and just overall airway health, because that's something that's been really top of mind for myself recently. I don't mouth breathe myself, but my older son has had enlarged tonsils since getting sick in the wintertime. And it's fascinating to see how directly it impacts his nighttime breathing, considering that he has such a narrow passageway to an airway. He then starts to snore, and then we listen for it and we'll close his mouth to try to keep his mouth closed. We're actively working on finding strategies to help him move through that, but it's been an interesting just awareness to have, and something that I've been aware of ever since having my babies, like really looking, are they breathing through their nose while they're sleeping? Does their mouth open when they're sleeping? And just like closing it myself if they do open or whatever. But I would say for the most part, like they've been pretty good up until this point. And so moving on towards I'm sure you have you talk about all of this in your books. For people who want to learn more about this, I think definitely go and read your book. But what are just a couple of things, main points, main tips that you think people can take away from this as like ways that they can be improving their oral health? I think brushing and flossing is like what most dentists will say, but then it doesn't really go beyond that in my experience working with different dentists over the years. And then there's also like some people who say, oh, you don't even need toothpaste. So it's funny, you'll hear everything across the board. In your like experience and what you've seen with your clients, beyond brushing and flossing, like what other things can people be doing to be really maintaining healthy oral health?
Yeah, I think you brought up a good point that, most will say brush and floss, and then it's kind of like buck stops there. And I think it's because so few dentists even realize the complexity of the mouth and how it actually affects the whole body. And I think what I really want people to take away and why I wrote the book is what I noticed in my practice is so many people were coming in with these systemic diseases. They were on a pill or some sort of treatment modality, but they never got to the root cause of what was going on. Or they were taking medication and they were still having symptoms, or the disease wasn't getting any better and they couldn't really figure out why. Or also you had this patient and they just weren't feeling great, right? They were having some digestive issues, inflammation, maybe their joints were a little creaky, they were tired, but you go to your primary care doctor, they run blood tests, they say everything's fine. So what I wanted people to take away from the book is don't discount the effect that your oral health has on the rest of the body, because if you have inflammation or infection going on in your mouth, it could be causing some symptom downstream that's actually not related to whatever you're being treated for. It's related back to the mouth. Inflammation and infection is never good, no matter where it comes from. So I wanted to point across. And then the other thing, in order to get effective treatment, you have to know what you're dealing with. And so in dentistry for years, and I was trained this way and I practiced this way for a long time, come in, we'd see an infection and we throw the kitchen sink at it. And it was like a one size fits all treatment plan. And then the patient would come back 3 to 6 months later and they weren't any better. Their gums were still bleeding. And I've heard people say this all the time. People reach out to me on Instagram every day saying, my gums have always bled since I was little. And just tells me that just how I am. It's genetic. And that is not true. The reason why they're not getting any better is because they've never been diagnosed properly. And so I encourage everyone to get a microbiome test. Go get a saliva test. See what your microbiome is, just like with your gut health. Get a test. See where you're strong, see where you're deficient. You may need some dental treatment, again, dealing with something a little bit different because we actually have to remove etiology. And then once it's clean, we can give you the tools that you need to maintain it. Mouth tape at night or oral probiotics, prebiotics, toothpaste. So testing is key. We need to know what we're dealing with. And then I tell everyone, you must use an electric toothbrush. It's a must for 2 minutes. 3 times a day, depending on your systemic condition. So if you have systemic disease or you're trying to conceive, it should be 3 times a day. People must floss twice a day. That's non-negotiable. And then in terms of products, we really need to move away from using super harsh alcohol-based 99.9% of bacteria. It's not good because we're killing both bad and good bacteria. And the 0.1% that's going to survive is not going to be the good microbes. It's going to be the super strong zombie microbes that we want to kill. And now they're going to overpopulate. So use gentle products, chemical free, hopefully. And that way being too harsh on your oral microbiome and you're supporting the good bacteria in there and so that they can do their job.
Mm-hmm. And in terms of preserving the healthy microbes in the oral microbiome, when you go about treating a patient to correct the imbalance, the dysbiosis, how are you doing that? Are you using antibiotics? Do those antibiotics also, because you mentioned just like staying away from harsh chemicals and things like that. So I'm just curious, like, what does that treatment look like for both in the way that you practice, as well as if somebody is going to see their local dentist or whatever, how do they go about correcting this dysbiosis?
Yeah. So when we jump in to treat, I want to make sure people understand, like, we're wiping out the microbiome. We're wiping out the good and the bad. Because at this point, there's an infection present and we need to get that out of there and then start fresh. So typically a treatment's going to look like periodontal cleaning, which is cleaning above and below the gum line. The gum line, that's where most of the good bacteria live. It's beneath the gum line where all the issues are. So we got to go underneath the gum line, disrupt that biofilm that's there, remove all the tartar. Then what's really important is half of the 11 pathogens that I mentioned earlier that cause disease are resistant to that type of cleaning. And so that's where most people fall short, is they only get a deep cleaning, if you will. That's what a lot of people know it as. So you have to go further than that. And one is you can do some irrigation. You can use some antimicrobials to irrigate out the gum pockets. Ozone is great, antimicrobial, but it's not like an antibiotic, right? It's not going to get into the system and cause a lot of issues. Reduces the amount of bacteria that enter the blood. Ozone is really fantastic.
So hold on, for a second on ozone. Doing like an ozone irrigation with a periodontist is what you're saying, not just like an ozone water swish, right?
Water swish is great once you're rebound. Doing an irrigation with periodontist or a general dentist or hygienist would be great. I love tissue lasers. Probably one of my favorite things, because think about it. This is your tooth and your root, and these are your gums. If we're cleaning the tooth, but bacteria are getting to the gum tissue into the body, you also have to clean the gum tissue. And a lot of people forget to clean the tissue. And so their tissue never gets any better. Bacteria still get in their bloodstream. So tissue lasers are really great for decontaminating the gum tissue. And once all that granulation tissue is removed, the gum tissue will reattach to the tooth and seal off the tooth. That way bacteria aren't getting underneath the gum line and getting into the bloodstream. So those are some of the main treatments that people will get.
Or how is a tissue laser different from a red light, like a oral red light thing that you put in your mouth?
So it's different wavelengths. We're using like 980 or 810 length. We're also going inside the gum pocket. And we're actually, like I say this, it's like a curetting motion where you're going in and scraping the inside of the tissue. So it's mechanical, but then the laser light is also going to obliterate the cell membrane of the bacteria. So it's doing two different things. When you're using the red light therapy, that's not really going like underneath the gum tissue. It's surface level. Great question.
Okay. I use one of those.
Yeah, no, I think they're great. And what I tell people is, let us get you clean and let us get you healthy. Take a post-op saliva test to make sure your microbiome is good. And then whatever tools you want to use at home to maintain it, go for it.
Yeah. And I think maybe now might be a good time to share just a little bit of my own experience with my dental health. I do believe like I was inoculated by my mom in some ways, right? I was born by cesarean, but I still think she was still the main like microbial environment that I was surrounded.
Like baby lips, like I'm doing it right now. I have a 10-month-old, and like the other day, this morning, I caught him like he didn't eat something off a spoon, and I put it and I went to and I was like, oh no, don't do that. Yeah, you are inoculated.
Yeah. And growing up, I had tons of cavities, and we ate a very whole food based diet. My mom made all of our food from scratch. Go vegetarian until I was a teenager. But even before I was a vegetarian, I had gotten tons of cavities. And then I had gone through my own health healing journey, more around just trying to improve my overall energy. And I was just tired all the time. I had really horrible period pain and just imbalanced hormones. And at the time, I wasn't trying to conceive or anything. So I wasn't like fully focused on fertility. But I did find that like the more I addressed the root causes, the foundations, then my fertility started to improve. And I also noticed my oral health started improving too. I was getting less cavities. I wasn't having any issues until I had kids. And this kind of leads me to, I would say, the more interesting part of my dental journey has been probably about 3 years ago. So I've been now pregnant or breastfeeding for the last 7 years. And about 3 years ago, I started noticing some erosion along the gum line. And the dentist that I had gone to see was like a biological systemic dentist. And she just was, oh, it's because of the salivary changes in the pH. There's not really much you can do about it. And part of me was like, okay, like I can accept that. And then there was another part of me that was like, why would that happen? I always like to ask, why does nature do things the way that it does? And because after that point, I had really started to pick up my dairy intake. I was like, oh, maybe I'm not getting enough calcium. I'm not getting enough minerals. There's no way I wasn't getting enough calcium at that point. I was doing a ton of dairy and really doing a lot of like mineral-rich herbal teas and really seeing no improvement despite having regular cleanings. And that then led me to recently, on my husband's recommendation, my husband's a naturopathic doctor, and I was showing him some of the erosion, how it's been getting worse. And he was like, you need to do an oral microbiome test. And
What?
And so he had me do an oral microbiome test, and I got it back, and you're going to be shocked. But of the 11 disease-causing pathogenic bacteria, 10 of them were sky high. And I don't remember the one that wasn't. But I was like, that's why my teeth are breaking down. But it's interesting thinking about this in the connection to fertility. My fertility is, I would say, optimal, right? Like I have 14-day luteal phase. I've produced cervical mucus for 5 days. I'm 32. Like I have all the signs of normal, no symptoms, like really great cycles. And I think you brought up, it comes back to the strength of your immune system and like essentially how, you didn't use this word, but essentially how resilient your body is to the presence of those bacteria in your mouth. And that's, to me, that's got to be the only reason why like that overgrowth of bacteria in my mouth is not affecting me systemically. I'd love to hear if you have anything else to add to that of like why I might not be seeing any fertility symptoms or things like that. But considering like that, as I'll just kind of add that to the list of potential like symptoms that people may not be experiencing or may not be noticing, right? Like just a little bit of brownish along the gum line. And in the dentist that I was seeing, she was shocked. She didn't consider ordering an oral microbiome test, but she was shocked when she saw it. She was like, wow, are you sure? Like this, your teeth look like you're swishing with energy drinks. And I was like, no, I definitely don't do that. It's pretty fascinating to see just how many like healthy habits I practice. I swish with ozone water, I brush and floss regularly, I tongue scrape. I just recently started doing oil pulling more often. And so it's been interesting to hear what you have to share that, okay, I think like a deeper cleaning is going to be necessary. And
Absolutely.
honestly, I'm a little surprised that she hasn't
No,
recommended that.
you need to get it treated. Thank you for sharing your story. And this really like helps prove my point, right? That you can have this bacterial overgrowth, but you, as you said, you're so healthy, right? You have a very healthy diet, very anti-inflammatory diet. Your gut health is super healthy. And so when we don't have a lot of factors going into our body that's causing systemic inflammation, our gum tissue is not breaking down. So our gum tissue is like our skin. It's a protective barrier in our body, just like our gut is a protective barrier. It keeps all the toxins in, not leaking out our abdomen. But when we get leaky gut syndrome, our gut breaks down, and now everything that's supposed to be on the inside is on the outside, and that's when we start getting all these symptoms. The gums are the same way. The gums are supposed to keep what's in the mouth in the mouth. And when someone's immune system is not robust, the gum tissue will start to break down, and then all the bad pathogens in the mouth get to the rest of the body. So that's why it's not affecting your fertility, which during your results being that high and not having any systemic issues, like that's awesome. But it also goes to show like there are other symptoms in the mouth, such as erosion. And you were smart enough to pick up on that and be like, hey, look, something is not right. I didn't have this here before. Teeth just don't erode. Like something has to happen. Like your bones just don't start eroding, right? You don't just get an ulcer on your skin. It's good that you went and you started saying, what's actually happening here? And the thing with erosion is it can be caused by a lot of things. It can be bacteria are going to produce acid. It can also be produced by a lower pH in the mouth. Also be produced by mineral vitamin deficiencies. Important about calcium is women, calcium is really important for our bones, but calcium has an affinity to go into our soft tissues before it goes into our bones and teeth. And so in order to put calcium into bones and teeth, we need vitamin D3 to carry it. But vitamin D3 has to have K2 as part of it. K2 is the signaling molecule. So a lot of people will tell me like, oh, I take tons of calcium, but it's to the wrong place. And then they end up with heart disease.
Exactly. Yeah. And that's a big emphasis. I was just talking with a client yesterday about, he was saying he's taking vitamin D3. And I was like, okay, it has to have K2 with it. Yeah. That's like the bare minimum. But yeah, and I think moving towards the topic of nutrition, what kinds of foods are you placing an emphasis on when it comes to supporting overall dental health and oral microbiome health?
Yeah, so definitely not a nutritionist, so I'll say that. But what I tell people is just common knowledge stuff, which is don't eat processed food. So anything that's in the center of the grocery store, try and stay away from. If you do have to eat something processed, try and do limited ingredients. Make sure you understand what the ingredients are, organic if possible. And tell people mainly stay away from gluten and stay away from sugar. Those are, if you can stay away from gluten and sugar, a lot of your inflammation will subside. I tell people if they're going to do animal products, just make sure they're grass-fed organic meats. I eat mostly plant-based, perfect, but I'd say about 95%. So I tell people fruits and veggies, always the better. And then healthy fats are super important too, that we need to make sure we're getting. A lot of people are afraid of fat, and fat's actually really good for us, good for our brain.
Good for brain, good for fertility.
Yeah. The good one is that I tell people is, and we are horrible at this, and I have in my past life was horrible with this, like fiber. Where did all the fiber go, right? We no fiber in the American diet anymore. Biotic fiber, soluble fiber, we need all of it.
Mm-hmm. Yeah. And yeah, I think I always place a big emphasis on healthy animal fats. Vitamin A, D3, K2 are really going to be found in those types of foods.
And we need vitamin A for our teeth, vitamin C for our gum health.
Mm-hmm. Yeah. Yeah. So a big in terms of like nutrition for healthy oral health outside of having pathogens would be like tallow, lard, grass-fed dairy, high quality animal-based proteins, mineral-rich foods like dairy, leafy greens, organ meats, seafood, shellfish. All of those are going to be really high mineral foods, and making sure to keep those in balance, because it can be, you can do too much of them. And yeah, so I think the fat soluble vitamins like A, D, and K, and those are going to be some of the big ones. But then when it comes to overall health. Yes, I'm a nutritionist, but I also recognize that just like my story shows, it's not just nutrition that's going to be the solution. So I think it's really going to be a holistic approach to supporting, how would you say it, supporting a healthier pH level in the mouth through supporting a healthy microbiome.
Yeah, exactly.
Yeah.
And say the bacteria that you have get there overnight, right? You may have this for a long time because you are so healthy. You were able to keep this day and not even have any oral symptoms a long time. And I love that your husband said, take an oral microbiome test. That's genius.
My husband is very cutting edge in
Oh, I
terms of the
love
way he
it.
practices.
Yes, I love it. That is so good. You really test, you're not going to know. Or maybe you're having a symptom, but you're just
Yeah.
not aware of it. So it's just always test. Take a holistic approach to your overall healthcare. That's what I tell people all the time, especially with fertility, because people are spending tens of thousands, if not hundreds of thousands of dollars on fertility treatments before they've looked under every hood, right? To see if there's something that's contributing to the infertility. So
Right.
what I tell people is health easy. Like it's so easy to get it checked and to get it tested. And if there is something wrong, we can treat it, which is really good news for a lot of fertility patients. Sometimes we're told like, you're broken, you're never going to have a baby. This is not possible for you. It's something that you can win at. And so
Yeah, I love that you're saying that, because that's a big way that I like to practice is really saying, okay, what is the body trying to communicate to you through the only way that it knows how,
yeah.
right? Like through symptoms, through signs and changes in your body. Then like, how do we then interpret what that means? And I find so much of infertility is really just lazy medicine. I don't want to say that like doctors aren't trying, but I think the system is broken in the sense that like they just don't have enough time with their patients. They don't have enough time, but they're also burnt out. So they don't have time to do continuing education, to learn more about how to help the patients. And I think when it comes to supporting overall health and fertility and hormone balance, it's what rocks do you still need to look under? And I think there are still so many like rocks that aren't turned over that people often skip, and then they just go straight to fertility treatments. They're like, oh, I can't get pregnant, let me just do this treatment. Whereas there's an obvious or maybe it's not obvious, but there is a reason. Sometimes you have to look for it to really figure out like, where's my body asking for more support. So I think this is just one more of those things that we can look towards as, okay, this might be something to look for. And on that note, I'm often sharing about the importance of the 3 months prior to conception, and how that's really when the eggs and the sperm are developing, and how our actions that we take, the toxins that we're exposed to, the inflammation that we're exposed to during this preconception time can directly impact egg and sperm quality, as well as they can have an epigenetic influence on the DNA of that baby that is conceived. And so with this in mind, what kind of dental work should couples be avoiding leading up to their conception? And perhaps asked another way, if couples have some time before they're ready to conceive, what kind of dental work would you recommend accomplishing prior to their 3-month preconception window?
Yeah, great question. So anyone who's trying to conceive have to get a saliva test. That's first and foremost. Have to get a saliva test, and you have to test your partner, because it takes 2 to make a baby, and bacteria are contagious. So if we only treat the mom and the dad, the infection, he's just going to re-inoculate the mom. So we got to make sure that we are treating both parties, and same-sex couples too, because even if they are doing fertility treatments, again, that bacteria is transmissible. So treat both. Then get the perio treatment done if it's needed to, at least 30 days, or in terms of that affecting conception or fertility treatments, trying to do it naturally, you're saying 90 days. Do it as soon as you can. The thing is, I tell patients, always make sure that you get x-rays and a CBCT, which is a 3-dimensional x-ray, because you want to look to see if there's any latent silent abscesses going on. So for instance, I'm a dentist, and before I went in, I was a fertility patient for 6 years. So this is why this topic is so near and dear to me. Not once did I have a reproductive endocrinologist ask about my oral health, but being a dentist, I was like, let me do my own workup here. And I took a CBCT, and I had an abscess tooth and had no idea, no pains, no symptoms, anything. So I was able to get it removed before starting any of my journey. But that abscess would never have been caught unless I had a 3D x-ray taken. Our teeth are 3-dimensional objects. So if you're getting traditional 2D x-rays, you're missing 30% of the anatomy there. Get dental x-rays, make sure you don't have any big cavities, make sure you don't have any dental abscesses, and get all of it treated prior to trying to conceive. You don't need to do like whitening and veneers and like all of this optional cosmetic stuff. That's not needed anyway. But I actually was just recording a webinar right before this. People will say, wait, I'm already pregnant. It's early in my pregnancy. I think I have an abscess tooth, or I think I might have a gum infection. Research shows you must get that treated, even if you are pregnant. Dental treatment is safe. Certain modalities of dental treatment are safe during pregnancy. It reduces pregnancy complications, reduces the risk of preterm birth, reduces the risk of mom getting preeclampsia or gestational diabetes, and reduces the risk of miscarriage. The thing about dental infections and gum infections is they only get worse throughout pregnancy because our blood volume increases, our hormones increase, and our bacteria increase the longer that they are there. So the longer you wait, the more that bacteria is getting to your baby. As soon as you identify that you have an issue, go get it treated.
That's a really good thing to know, because when I had started preparing for my first child, I went and I started working with this woman who was a naturopath, a midwife, and an IBCLC, a lactation consultant. And I was like, okay, you're like an all-in-one person who can help support me on this journey. I was like, what kind of things do I need to do to get done in advance? And she was definitely recommending like whatever dental work getting done in advance. But that's good to know that like it's better than not. Like if you're already pregnant, it's better to get it done than not. The only question that comes up is a lot of times there's like pain relievers that are used, or what are they called? Anesthetics.
Anesthetic.
That are used to do dental work. Would those be avoided in pregnancy, or would they be harmful in pregnancy?
So anesthetic does cross the placenta, but the problem is that if you don't, it hasn't been proven to have adverse effects on the baby, first off. Secondly, if you don't use anesthetic and the mom gets in pain, now you're releasing adrenaline and now you're causing inflammation from that pain response. That is way more harmful to the baby than using anesthetic. I always say to go ahead and use anesthetic with epinephrine. Make sure as a dentist, you're putting it in effectively so that you don't have to re-anesthetize multiple times, and just make sure your anesthesia is profound. If you're going to use anesthesia, make sure the patient doesn't feel anything so you can get in and get out as quickly as possible. That way you're not causing any kind of long-term immune response. Mm-hmm. But yeah, it does cross placenta. There's no studies that I'm aware of that it causes any damage, but it's better than not using it and being in pain. Now, if you're doing a cleaning and maybe you have a high pain tolerance and you don't need anesthetic, then don't get it. But if you're getting a cavity filled or something, like, yeah you should get it.
Okay. One of my last questions is going to be for people who are planning to conceive, how should they know, like, to look a little bit deeper into their oral health? You mentioned getting tested, getting a microbiome test. Is there any other tests that they should be considering that they should be asking their dentists about to dive deeper into this from a preventative standpoint?
Yeah, microbiome test is a must for sure. Very few dentists actually will provide it. So they can go to people like your husband. I do telehealth services for patients. So people will contact me. I can ship them a kit to their house and go over the results with them. So microbiome test is crucial. That's really the big one. The other one that I was talking about was that MMP8 enzyme. That's the immune response to where it'll break down your gum tissue. And then let the bacteria into your bloodstream. That's not widely available in the US yet, so that would be very hard to get. Only a few practitioners actually have that. And then another one besides x-rays that people could get is like an oral cancer test with some sort of modality like a Visalite or a Velscope that just helps clinicians see beneath the surface to make sure that there's nothing going on, because you don't want to get pregnant and then find out that you have a potentially cancerous lesion somewhere.
All right. Thank you so much for taking the time to share your knowledge with my audience. And
you're welcome.
I would love if you could just share where people can find your book. Your book is called Saved by the Mouth, and where they can find you online if they want to work with you or learn more from you.
Sure. So yeah, the book is called Saved by the Mouth. It's written for patients. It's a kind of a high level overview of oral systemic health. It's written in a real fun, cheeky sort of way. So I tried to make oral health as interesting as possible. And they can buy that on Amazon or Barnes & Noble. And then people can contact me on Instagram. My handle is Katie Lee DDS. And then they can also go to my website. I do, like I said, telehealth services for patients now if their dentist doesn't do saliva tests. so people can book an appointment with me. I'll ship them a kit to their house, and then I'll go over the results with them. But then I'll also create a care plan for them of what treatments that they need, and then work with their current provider or find them a provider that can render those services. So they can find me on katieleedds.com.
Great. Thank you so much.
You're welcome. Thanks for having me.
I hope you enjoyed my conversation with Dr. Lee. In this conversation, Dr. Lee touched on two important takeaways that I want you to remember as you go on to supporting your own fertility. Number one, your gut microbiome, and that includes your mouth, has an important role in preventing systemic imbalances. And number two, addressing oral inflammation is critical to prevent inflammation elsewhere in your body. This is why in my course, Resilient Motherhood, a self-paced guide to preparing for conception and beyond, taming inflammation and optimizing gut health are foundational topics that I address and share exact strategies for as you go about your own preconception preparation. As with everything, oral health is only one piece of the puzzle when it comes to achieving optimal fertility. I also dive deep into nutrient density, optimizing mitochondrial energy production, supporting optimal liver detoxification, supporting a healthy nervous system, how to enhance your carbohydrate tolerance and balance your blood sugar without having to cut out all carbs, and how to align your circadian rhythms to maximize your hormonal balance and make all of these other systems run more efficiently. If you want to learn more about how you can support your fertility, check out my free masterclass, Unlock Your Fertility: How to Transform Your Habits for Optimal Pregnancy Success. And if you're ready to have my step-by-step strategy for how to personalize your own preconception protocol so you can conceive your dream baby on your own timeline, it's time for you to join me in Resilient Motherhood. Click the link in the show notes to join. I hope to see you there. Thank you so much for listening today. I really do appreciate you choosing to spend this time with me. If you gained value from today's episode, I'd love if you can act in reciprocity and share this episode with a friend. Screenshot your favorite part to share on your social media, tagging me at Anissa Woodall Nutrition, and leave a review in Apple Podcasts. This serves me to expand my reach of connecting with women who need this medicine. I'll see you on the next one. I hope you already know, but for legal purposes, I need to share that this podcast is for general informational and educational purposes only and does not constitute the giving of medical advice. The use of this information and the materials linked to this podcast are at the user's own risk. Each user is responsible for making their own decisions when it comes to their reproductive health. Remember, you are always the sole authority over your health, and if your case requires medical attention, use your own discretion to ensure that your needs are met. Thank you for listening.